like to come over to the ACCAI, and it's not my first time. I like this kind of congress with the combination of basic science and practical things and treatment, and I find it interesting, very much interesting every time I'm here. I'm interested in HAE. I'm leading an ambulance for several hundred HAE patients in Mainz in Germany in our outpatient service, and we are treating them for a long time already, and the patient become more and more in the time. There are a lot of guidelines and treatment recommendations for HAE patients. A guideline from the World Allergy Organization will appear. Then there are guidelines from the HAE International Patient Organization, US Patient Organization, national guidelines. We have a German guideline also. But more or less the issues are the same: treatment for acute attacks or prophylaxis, and in special cases short-term prophylaxis before surgery and so on. So the recommendation for treating acute attacks vary a little bit between different countries, because not in all countries are the same drugs available. For instance, in Europe we have for the treatment of acute attacks available C1 inhibitor concentrate. That means human plasma-derived C1 inhibitor. We have available icatibant, bradykinin B2 receptor antagonist. We have available Ruconest, which is a recombinant C1 inhibitor, but we have not available ecallantide, as in the States, for instance. And we have available for prophylaxis the C1 inhibitor concentrate, and we have available tranexamic acid and the androgens. Tranexamic acid is not used very much in Europe, and I personally didn't use it for that, at least for that indication. This is our arsenal, which we have for this disease. But in practice, there are a lot of other measures necessary, not just only prescribing a drug for these patients. I think until now we have no ideal treatment for this disease. The treatment improved considerably in the last few years, especially in the States, but also in other countries and also in Germany. We have more treatment options available, but until now we have no ideal treatment. An ideal treatment would be prophylaxis with no side effects, so that all attacks can be avoided. But this is at the moment not possible. Few drugs are in the pipeline, and I hope that there will be further developments in the next few or more years, that we have more treatment option for this disease, which is a really heavy burden for many patients, concerning the potentially life-threatening laryngeal edema and also the other disabling attacks like abdominal pain attacks, which are so severe as renal colics, and the skin swellings are disabling also.